Hello, welcome to this video which I will explain the basics of Medicare. You will learn the ins and outs of Medicare, so grab a pen and paper and your favorite drink and let's dive into it. Okay, so we're gonna start with the presentation. The title is Understanding Your Medicare Plan Options. But before we continue, I want to tell you who I am. So I am a local independent agent here to help you with your Medicare choices. I focus on the areas of San Diego and all California. The name of my agency is Simple Health and Life Insurance Agency. It's me and my husband that we work together. My name is Katia Montanes. Here's my license and obviously my phone number. I just want to tell you what I offer to the table. I'm a licensed, certified, and trained to understand how Medicare works. I spent about 80 hours obtaining certifications from all the top carriers in your area, so I'm well educated with them. I also have to pass an exam called AHEP each year, which it covers all the basics of Medicare, fraud, waste, and abuse training. And also, I'm trained to use Medicare.gov to compare prescription drug plans to make sure we find that plan that works the best for you. I am what they call the health insurance agent, and I want you to really understand the difference between the two. An agent is a person who acts on behalf of another person or group. So when you work with me, I am not gonna bombard you with information about a specific plan or in a specific carrier that I work with. I'm actually gonna ask you questions, personal questions, so I can find the right plan for you. So that's the big difference between calling a 1-800 number or calling me as an agent. A 1-800 person, they just have products, right? They just work for the company and they're going to make sure that they sell you. And that's when the confusion starts. Oh, you got to change your doctor so your medications are not covered and things like that. When you work with an agent, the agent or us or me, I'm just more focused on you to make sure that you are in the plan that you prefer and that works for your circumstances. And after the time of the enrollment, or what I can offer you is, or my promise to you is that I'm going to totally give you an unbiased opinion, and I'm going to tell you why in a little bit. I'm actually going to educate you in all the Medicare plan options. So not just one carrier, all the ones that are available in your area that work with your circumstances. Also, there's going to be a no-cost annual benefit review, and I'm going to tell you when that's going to come to play and why it's important when we go more into the presentation. And the best thing of the best is I'll be here all year round to help you with any questions or concerns or plan issues. This is huge. So when you go into Medicare or you're already in Medicare, there is a lot to learn. There is a lot of issues, not a lot of issues, but there could be issues that happen throughout the year. And as an independent agent, this is my full-time job. So I'm available to help you, not just to find the best suited plan for you, but also to service you all year round. Nobody wants to call the 1-800 number. You want to call a person that it's a local, that it's here to help you, that understands you, so that way you can resolve those issues faster. And a little bit earlier, I mentioned that my opinion is unbiased. And the reason why is because, and I think this is great with the CMS or Medicare and also the carriers have done for us, is that they compensate us equally, right? So it doesn't matter what insurance company or carrier you decide to pick or what form of Medicare you decide to pick, I get paid the same amount. So that makes it really easy for us to be your advocate and to just be able to be that person that educates you on your needs, on the plans that are there, that best fits your needs. So enough about me. Okay, we said that the presentation is going to be focused on Medicare, so let's dig in. Let's go into our Medicare choices. The first thing first is we want to understand what are our enrollment periods. Okay, so The first enrollment period is called initial enrollment, right? And this one is a 7-month window that you have when you turn the big 65. So the big 65, you have 3 months before you turn 65, the month of, and then 3 months after. Okay. So because you can enroll when you turn 3 months before when you turn 65, just know that your effective date on Medicare is going to be the month of your birthday. Okay. So let's say you turn in 65 in July. That means that you could enroll or start your application in April, May, and June, but it's not going to be active until July. The same goes with 3 months after. You can still enroll with your application, but they might make you wait. So, for example, if you turning 65 in July, but you didn't put your application until July 30th, you're probably not going to get the enrollment effective August 1st. They're going to ding you and they're going to make you wait a month. So it's probably going to be September. So that's why that window 7-month initial is very, very important to pay attention to and to work with somebody that knows how Medicare works, because if you don't enroll on the periods that you're supposed to, there could be penalties and they could follow you for the rest of your life. The other period that we have is called the open enrollment period. So the open enrollment period is for people that throughout the year when they turn 65 or later on in life, they never enrolled into Medicare, so they have a special enrollment or open enrollment period from January to March 31st to be able to enroll in Medicare Part B. Penalties apply on this one. Then you have the special enrollment period. So for that one, it's usually for people that dropped an employer group. So if you are currently working and you don't want to retire after 70 or after 68, you don't want to retire. At the moment that you decide to retire, you can enroll into Medicare if you're past that 65-year-old window. Another people that have special enrollment is what they have programs like Extra Help, or they're eligible for Medicare and Medi-Cal. And there's also emergency situations like emergencies like COVID and things like that that might apply a special enrollment. So it depends on the moment and the emergency that the state is currently at. The other period that a lot of people are aware of is the annual enrollment period, and that one goes from October 15th to December 7th. This one is for people that want to change a Medicare Advantage plan, or they want to go back to original Medicare, or they want to change their prescription drug plan. So it has nothing to do with Social Security or Medicare Part A or B. It has to do with the plan itself. And things are going to make sense as we go along with the presentation. But the important ones that we're going to talk about, the Part B, is your initial when you're turning 65, and also maybe if there is a special enrollment period that applies to your specific circumstances. All right, so let's say we already enrolled in our Part A and B of Medicare, and we got that nice little red and blue card with us. Now what? So everybody knows that Medicare covers 80% if you work the right amount. If you work your 40 credits or your 40 quarters, what they call it here in the U.S., and you're entitled to Medicare, or perhaps you're entitled to Medicare because of your spouse. You have A as a zero cost, and then you have B that will have to pay a cost, and we're going to go through those costs in our next slide. But let's say you have your Part A and your Part B, they cover 80%, and you have to pay for the other 20. So you can leave it like that, like it mentions in option number 2. You can leave it as original Medicare, and it's going to be 80-20. But that's not the best setup, because unfortunately that 20% does not have a cap. does not have a maximum, right? So usually when we're younger than 65 and we have a medical plan, usually, we have, I don't know, $8,200 on maximum out of pocket. So if I come down with a major medical emergency or terminal illness, I know that I'm not going to pay more than $8,200 for care. Now, Medicare does not have that, does not have a cap, so it could be very expensive. So we need to find choices to cover that 20%. And the choices are, hold on, I apologize about that ring. So the choices are, first, you can stay with your employer group plan, right? When you turn 65 and you're still working, you can stay with that. You can either go into what they call Medicare Advantage, right? And we're going to go into the cost and what is involved into our Medicare Advantage HMO plan. Or you can go to a Medicare Advantage PPO plan, and we're going to discuss those in the next slide. Or you can just pick number 4, that is a Medicare supplement with a standalone prescription drug plan. Now let's dig in onto these options and see what is best for you financially. Okay, so we're gonna be on a little bit of we're gonna spend a little bit of time on this slide. Okay, this is the Medicare basic. This is how we decide what coverage we want to get. Okay, so one of the ways one of the coverage was to stay with your group plan, right? So we can totally do that. And the important to determine at the moment when you're turning 65, or if you're deciding to go into Medicare or not, is we want to compare apples to apples. And we do this in our office all the time. I usually tell people, if you're on the fences about Medicare, should I leave my group plan or not? I'm still working. We always ask how much you're paying for your premium, and please send me your summary of benefits. And when we look at the summary of benefits and we look at how much you're paying, we'll let you know if it's worth it or not to go into Medicare. And I'll tell you something, it's about 50-50. 50% people should stay with their group plan. It's perfect because the employer maybe pays for it 100%. Or it might be better to move into Medicare because you have to pay 50% of the cost. So at that moment, just send us the information and we'll tell you how, what's best for you. Now, for those that that don't have an employer group plan, but they have to get a coverage to cover for that 20%, we talked about that you can go with Medicare Advantage or you can go with Medicare Supplement. And here in this little table is the two, okay? So let's focus with the Medicare Advantage at the bottom first. So the Medicare Advantage at the bottom, if you see here, is the cost is $0 to $98. How do we get to that? So Medicare Advantage will group your Part A, your Part B, and your Part D as in drug, and it will make it all together as your Part C, what that's supposed to mean to you. So your Part A covers for your hospital coverage. Usually people don't pay anything for this because they have worked the necessary quarters to cover for this, for Part A, so you don't pay anything. Then you have your Part B, which charges you $170.10 right now as of 2022. For the most part, it goes up every year. So $170.10 is the norm that people will pay for their Medicare Part B. Some people might pay less because they have certain programs. Some people might pay more because they have a little bit of higher taxable income. So you pay the $170.10. And then you have what they call Part D. Part D is your prescription drug plan. And the prescription drug plan is the only plan that is required by law from Medicare that you have to enroll. If you don't enroll in a prescription drug plan, you're going to have penalties, okay? So the Medicare Advantage plan says, okay, so you Social Security or Medicare is charging you $170.10 for your for your Medicare Part B. What I'm going to tell you is I'm going to take care of the 20% that you're exposed to. You don't have to pay me anything for premium for the most part. And then you're going to pay copays on certain medical care that you incur during the year. So I like to see it, the Medicare Advantage, I like to see it as a pay as you go plan, right? I don't pay anything for premium for the most part. There's plans out there that you have to pay a little bit of premium, but then they take care of my 20%, but I have to pay co-pays, okay? The other thing about Medicare Advantage plans is that they have a network, okay? So doesn't have any cost. It says pay as you go type of insurance, but you have to stick within certain locations or certain doctors, and you're gonna need referrals for care. It's an HMO plan. Now you may ask, Katia, what is the $98 that you're talking about here? So the $98 is that there is Medicare Advantage plans out there. There's other ones that are cheaper, but for the most part, the maximum is $98. And so there is Medicare Advantage plans out there that are PPO, right? And what PPO stands for? It stands for Preferred Provider Organization. So that means that those plans, there are Medicare Advantage. You have to stay within a network, but it's a PPO network, so it's a little bit bigger, and you don't need referrals to see a specialist. So let's say you feel that you need to go to the dermatologist. You don't have to wait for the primary care doctor to give you a referral. You can go to the dermatologist without referral if it's within the network that plan works with. Now you can go out of network, but your copays will be higher. Okay, so that's the Medicare Advantage. Now let's talk about the Medicare Supplement. Medicare Supplement, I like to call it the Cadillac of Medicare. Is the most comprehensive coverage you can get with Medicare, and I'll explain you why. Okay, so the Medicare Supplement is here on top. Is the one that you will pay about $295 a month. Okay, but I'm going to tell you what's involved in it. I'm including the $0 obviously for your Part A, and the 170/10. We know we have to pay that. That's by Medicare. And then on top of that, you have to pay it's about $10 to $15 for a prescription drug plan. The way we determine what prescription drug plan is best for you is by knowing the list of your medications. So there is a lot of carriers out there. There's a lot of prescription drug plans, but the way we know which one works best for you is by knowing the list of your medications, and I'll tell you which plan covers each medication the best. Okay, so that's why I said the cost will be anything between $10 or $15 depending on the medications that you have. And then on top of that, you're gonna get what they call a Medigap or Medicare Supplement. A lot of people know them as Plan F, Plan G, Plan N. Those are Medigap or Medicare Supplement plans. And so what this plan does is that you're going to pay, no matter what, you're going to pay that premium of $115 average, depending on your age and your zip code at the moment. And so you're going to pay that monthly premium. For the most part, if you decide to go with the Plan G, you're going to pay a deductible, and the deductible is $233 for the first visit or for the first medical care that you get. And after that, you don't pay anything. You don't pay nothing monthly. No matter what happens to you, you have to go in the skilled nursing facility, or you have cancer and you have to get chemotherapy, things like that, you're not going to pay any copays. And on top of that, you don't have networks. So your network is going to be original Medicare, which probably 95% of the doctors here in the U.S. work with. And like I said, in the U.S., so let's say you are in San Diego, you don't have to stay in San Diego to get care. If you know there is somebody in New York that is specialized in the cancer that you have, and somebody told you it was great, if you have Medicare Supplement, you can go and get care at that location. There is no network. Okay, so that's the benefits. A little bit more costly monthly, but it gives you more flexibility. It gives you more control for your care. Another thing that I get, another questions that I have is people that they spend, you're retired now and you have the privilege to go to different places and visit different places for vacation. So I have people that perhaps they spend 6 months in one place in one state and then spend 3 months in another. If you have a Medicare supplement, you don't have any problem having different set of doctors in different places. You can go anywhere in the US as long as they take Medicare. Okay. Now, I know you might ask this question about Medicare Advantage. The Medicare Advantage is, like I mentioned, you have networks, right? So if you travel, the good thing about the Medicare Advantage is that it will cover you for urgent cares or emergency needs if you're outside of your home zip code. One second. So a lot of people tell me, okay, well, it's a little confusing. Just tell me which one is the best for me. Which one is the best setup for my Medicare? And really, that depends on you, right? Obviously, we all would like to have the flexibility to control our care and to go anywhere, but not all of us have a budget of $300 a month to pay for our insurance. So it's really gonna depend on your financial situation and your lifestyle. Okay, so I made this little checklist that explains why Medicare Supplement or Medigap. Well, the positive things is that even though it has a higher premium, it doesn't have a copay. The deductible, actually, I'm so sorry I didn't change this, but the deductible for 2022 is $233. So you have to pay that annual deductible. And then after that, you will have no copays. That is if you decide to go with the plan G as in Gloria. You have the freedom to choose any doctor that you want. Like I mentioned to you, if you feel like there is a cancer doctor that works really well in Missouri, you can go there even though you maybe live in California. There's no referrals necessary, so you don't have to wait for a bunch of steps in order to get an MRI approved. And you are covered anywhere in the US. Okay, so if you like to travel and you want to settle doctors on different places, you can have that. The down part is obviously the premium, and also, not some routine services are not covered, like for example, vision and dental. Medicare Advantage have that. They include the dental and the vision into the plan, but obviously you have to go to certain locations for that. And also your prescriptions might be a little higher. This point right here is interesting. So there's certain specialty medications, like if you're diabetic or heart disease, that certain Medicare Advantage plans make it really low cost to attract you to their plan. So versus when you have to get your own prescription drug plan individually, there is a higher deductible that might affect that medication. So that's why it's important that you work with us. We work with an agent that knows the plan, because they can tell you the comparison between the two and see, if it's better for you to go with the Medicare Supplement or Medicare Advantage, depending on the list of your medications and doctors. Why a Medicare Advantage? Either HMO or PPO? Well, like I said, they generally lower premiums. For the most part, there is zero premiums. You don't pay anything monthly. You only pay the $170 and that's it. Includes extra benefits. So this is all the things that you see on the TV all the time. Free, right? So free vision, free hearing aids, fitness, dental, transportation, and even a Part B credit. Like they're bringing that now, that they said, oh, we'll give you back $1,000-something back on your Social Security benefits. So what it is that they give you a credit on that Part B premium that you have to pay monthly. So the plan gives you that credit. And then prescriptions, like we mentioned, might be a little lower, right? The down part is obviously that you will have a restricted network, so you have to stay within the network of doctors that the plan work with. If you decide to go with the HMO, not the PPO, then you're going to need referrals for a specialist. And if you're outside of your service area, then it only covers for urgent care and emergency needs. So you might ask, oh my goodness, I thought this was going to help me to make a decision. There's just so many options, right? And there is a lot of options. But when you have an advocate like me, we're able to narrow it down to your specific situation, right? So we talked about what MAPD plans is, which is Medicare Advantage. These are the HMO plans. We talked about Medicare Supplement, which is the Medigap, Plan F, Plan G, Plan N as in Nancy. We talked about prescription drug plans and what that involves, and it's important that you know your list of medications so we can find the plan that best covers those medications. And we also talked about PPO plan. They're a little bit cheaper than a Medicare Supplement, but they do have networks and they do have copays, right? And there's so much more. There is special needs plans. There is so many other things that, like, if you suffer from diabetes, or if you suffer from high blood pressure, or heart disease, there's plans specific for those conditions as well. So there is a lot to learn. So that's why you have us. You have your health insurance agent that specializes in Medicare, because I'm here. My job is to educate you, right? To educate you, give you the tools that you need so you can make the best decisions for your needs. I love this. Two heads are better than one. So when we get together and you tell me your needs and you tell me what the list of doctors that you would like to see, or the medications, or maybe I need transportation, or any type of needs, I'm able to narrow down usually your options by the top 2 or 3 plans that work best for your needs. And according to that, you can make your own decision. Remember that our services are completely free to you, right? So I'm not going to bill you with for my services. The insurance companies have us out here to be your advocate, to be able to help you and walk you through the maze, which is literally a maze of Medicare. So that way you are happy and you get the coverage that you deserve after working so many years here in the United States. Okay. So what now? Simply just request to request to learn more about our services. Fill out the forms fill out the form, click on learn more, and how to contact us. You can also call us directly to our office. Our phone number is 619-453-0333, or you can email me. My personal email is kmontanes, that's my last name with the Z at the end, at shlinsurance.com, which is the name of my agency, Simple Health and Life Insurance Agency. We appreciate the time and we hope we can connect soon. Bye.